I'm Janice Spiso, president of UCLA Health. Around this time of year, we hear a lot of different reasons why people don't get the flu vaccine.
I've actually had the flu shot before and it made me feel awful. I think it actually caused the flu.
Well, aren't some vaccines dangerous?
I never get the flu, I never get the shot. Why would I want to be vaccinated now?
I just don't think it works.
In reality, most of these reasons have no basis in truth. What is true is that in order for the flu vaccine to work most effectively and truly protect our community of patients and each other, we all need to get vaccinated. So let's set the record straight about the most common reasons why some people are reluctant to get the flu vaccine.
You don't think it works. It takes about 2 weeks after vaccination for antibodies to develop in the body and provide protection against the influenza virus. In the meantime, you are still at risk for getting the flu. And you can also get respiratory illnesses that are not the flu virus. That's why it's best to get vaccinated early in the fall before the flu season really gets underway.
You've never gotten the flu shot and you've never had the flu. If you get a flu shot, you will protect the people around you. Remember that if you are infected with the flu, you will be contagious for about 2 days before you experience any symptoms. By the time you start to feel ill, you may have already infected your grandparents, your neighbor's newborn baby, or the pregnant woman you gave your seat to on the bus. You may get lucky and have a mild case, but if you'd had your flu shot, you probably wouldn't have passed the disease on to those vulnerable people around you. After all, even if you've never been in a car accident, you still wear your seatbelt.
You got the flu shot one year and you think it actually gave you the flu. You cannot get the flu from the flu vaccine. There are 2 possible explanations why you may have thought that you could. First, you might have been infected by another respiratory virus soon after getting your vaccination. The vaccination won't protect you from other viruses, but those viruses are also unlikely to cause severe complications. Secondly, you might feel a little run down after getting vaccinated because your immune system is doing its job and building antibodies against the virus. These vaccines work by stimulating your immune system to attack certain parts of the surface of the virus. The flu vaccine cannot give you the flu. The real flu would be far worse.
You heard vaccines are dangerous. Flu vaccines have been given for more than 50 years and they have a very good safety track record. Flu vaccines are made the same way each year and their safety is closely monitored by the Center for Disease Control and Prevention and the Food and Drug Administration. We give over 120 million doses a year in the United States and carefully review the safety.
You're afraid of needles. The very minor pain of a flu shot is nothing compared to the suffering that can be caused by the flu. The flu can make you very sick for several days, send you to the hospital, or worse. Either way, a shot can prevent you from catching the flu. So whatever discomfort you feel from the minor side effects of the flu vaccine is worthwhile to avoid getting the flu and spreading the flu to your friends, family, and patients.
You just don't have the time. First, we have made it easier than ever to get the flu vaccine. From large-scale events at the beginning of the flu season to readily available appointments at our occupational health facility. Second, if you do get the flu, you'll be out sick far longer than it takes to get a flu shot.
Enough people get the flu shot, so I don't have to. This is simply not true. The fact is, the vaccination rate nationwide is well below what it needs to be to protect the community, and therefore you can still get exposed to the influenza virus outside the hospital and bring it to our patients. Flu prevention begins with you. This is your health, it's your responsibility.
There may be other reasons why you or someone you know chooses not to get the flu vaccine. The bottom line is, when you choose not to vaccinate, it could have a direct effect on you, your coworkers, and our patients and families. Every year, an estimated 36,000 Americans die because of the flu. So please, help all of us out and get vaccinated today. Thank you.
So Janice, ready for your vaccine?
Absolutely.